Hi everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you another in our series of interviews with top leaders in health IT. We're at the HIMSS 2022 conference, and we're excited to be here with Dr. Zafar Chaudry. He's Senior Vice President and Chief Digital and Information Officer at Seattle Children's, and also with Sunita Pradhan. She's VP of Customer Success, Hospital and Health Systems at ELLKAY. Welcome.
Thank you, John, for having us.
Thanks for having us.
So I'm excited to have a discussion. Let's kick it off here, and maybe you can start off, Zafar. Is when you were considering legacy data management, what elements were important when considering that partner?
Well, John, first of all, internally as an organization, we have to figure out how important our data is, how do we want to secure that data, how long do we want to keep that data? Because if you spoke to a clinician and said, how long should we keep the data? They're going to say indefinitely, right? And then if you sort of say, well, when was the last time the data was actually looked at? That might not be for many years.
And then you ask the lawyer, and the lawyer says, as little as possible because I don't want responsibility.
Yeah, absolutely. So when selecting a partner in this space, you want to make sure that you validate whether that partner can actually secure it, protect it, keep it well archived and backed up, and can they restore that data if it was ever lost?
Interesting. Sunita, anything you'd add working with your customers? What do they really look for, and what are the important elements?
Yeah, absolutely. So there are generally a few different stakeholders that are important to the decision for archiving. And that includes, from a financial aspect, if there's a return on the investment, if there's some operational savings, there's security for sure, making sure that their data lies in a secure place. As well as from a clinician workflow, can my clinicians get to the data easily enough from a day-to-day perspective? And then you also have the consolidation factor, right? How can we make sure that all of the data is in one secure environment and available to the users?
Yeah, simplicity seems like a really important element here. So Zafar, tell us about your effort. I mean, you moved to ELLKAY for your legacy data management. Tell us about that process.
Yeah, so the project really spun up from, we had Cerner and Epic together as systems. And a few ancillary legacy systems connected into that. And we wanted to go to a single platform on Epic. But one of the questions that came to my mind is, if we take all the data from all those systems, should we just put them into the core EMR? And if we do, what happens when we change systems 5, 7, 10 years down the line? So it made logical sense to work with the vendor to build a platform that A, could ingest the data, and I would say that's probably the easier part. The harder part is, how do you get your clinicians, your allied health professionals, your doctors and nurses to agree to the view of that data? Because every doc wants to see the data in a different way, right?
Yeah, they want the blood pressure in red in the upper left corner.
That's right, or the button isn't green, right? It should be red or it should be green. So it was really important to put the data in a place with a vendor who wouldn't lock us into, I've now got control of your data. And that was a vendor neutral sort of situation. So that's very important when looking at this.
So why was having just the single solution for all that legacy data so important?
Because we could then move it anywhere we want in the future.
Interesting.
We can connect it to any system we want today or in the future. And then we're not having to pay fees for data transfer, etc. So that was all what we saw in the value proposition with ELLKAY, is they could do that for us, and at any given time, it was still our data.
Yeah, interesting. Sunita, what would you add? I mean, what do you hear? You work with a lot of customers on this, so what do you hear from them in regards to this kind of single solution and the ability to access it effectively?
Yeah, I think especially now as we're getting to the next phase of the pandemic, a lot of hospitals and health systems are looking back and seeing, what applications do I have? Am I using them? Are they a security risk? How do I manage that data? And how do I choose a partner that can do the consolidation for me, but also what else can I do? So there's a lot of discussion around beyond archiving, what can we do together? Are they going to help me realize my data strategies, inclusive of archive, and are there other conversations I can have? So that's where a true partnership forms.
Yeah, that's interesting. So we kind of talked about the security aspects, which is a really interesting one. We talked about the, kind of patient care and accessing it in a way that's effective. What about the financial side of things? What's been your experience with that, and how did you kind of rationalize the investment in a legacy application vendor?
So I think when you're looking at patient data, it's less about saving money, but more about protecting that data. At the same time, when you're looking at that business case and model, yes, of course, if you have many, many ancillary systems, not only are you paying annual maintenance fees, but you're also paying people to take care of those systems, to water and feed those systems.
True.
And sometimes those applications are so antiquated that there isn't a support contract available, or you can't find the person who originally programmed that product. So when we're doing a consolidation, and this is certainly what we saw, is we took some major systems like Cerner, deprecated that system, had an annual maintenance fee that was very high, and now we just have the single fee, and we've fed this archive from ELLKAY with multiple systems.
Nice.
And as we configured it, and that's where the trick comes, right? The stakeholder engagement to configure the look and feel of the system, that's really been the big win. It's gone through multiple iterations, but at the end product is a physician can see the information in a way that they want to see it.
So what's been the end user response to this? I mean, have they embraced it? Because I've seen with where they implement it, but then no one accesses it, and then you're like, so how's it gone for the end users?
Well, I would say initially, as we were working through the project, there was variable responses, multiple stakeholders, some from labs, some from other specialties. It took some warming them up, but I think what really stood out in this project is ELLKAY's devotion to meeting those needs of those clinicians. I would say that any other company would have said, oh my God, I can't do this.
You're too choosy.
Right? Whereas the programmers and the people at ELLKAY worked meticulously with my team, with the clinical teams, till the final product was the product that people wanted to see. And that's very rare in the technology industry. And it wasn't done through a process of change control either.
Okay, interesting.
ELLKAY absolutely said, we are going to get this to work, we're going to make it look and feel how you want to make it look and feel, and we are true partners. And there was never a discussion of, and I could say this, they put thousands of hours into this, but there was never a discussion of, oh, you need to give us this or change this, or here's a change control, good luck. They didn't do any of that. And I think that's probably the big takeaway for me is, as healthcare organizations consolidate partners, because we're going to have to, because costs keep going up, you only want to partner with someone who really wants to be a true partner. And what I say is when you get into a vendor relationship, it's sort of like a marriage. There's more bad times than good times. And if we hit 7 years, we've made success.
Yeah, there's something to say that. And how does that align with like your organization's overall data strategy? I mean, you talked about you've already put some other systems in there. Is that the go forward path in your consolidation and kind of the data strategy?
Yeah, I think as systems age, you really do want to put them in a single place. The beauty of the solution is you can absolutely contextually connect patients, map data together. So within our Epic system, we can launch the ELLKAY archive, but we won't have to search for the patient again. The information will be there because the matching is done by, their
single sign-on,
their integration,
algorithms and everything they built. And that's what you would do with other systems. You look at your systems. If the system is only being used for a small period of time per day, take the data out, put it into a single view, connect it up to the EMR. That's really going to drive a better utilization.
Yeah, that's a good point. Sunita, is that what you see also with your other customers? And what should be the core of a hospital and health system's data strategy?
Yeah, that's a great question. We do see that. We see the ability to access the data through the EHR. In this case, with Zafar, it's the Epic being the front-end live system and a single sign-on to the archive.
Okay.
So that's important for workflow purposes. In addition to the clinician, HIM teams are important as the data becomes longer to be able to maintain the retention policies.
Yeah,
So
the release of information, etc.
Yes, exactly. Release of information, purging of data, and then also the informatics team who wants to be able to see that data, analyze it, and have access to actionable data. All of those things are important, and they're part of every conversation that we're having today.
Excellent. Well, thanks so much for sharing all your insights and perspectives on this project and your experience with this. It's really interesting. I mean, I think we've implemented so much health IT, and now there is a stage of consolidation where we're at. So appreciate you sharing your insights and perspectives, and thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com and search for Healthcare IT Today on your favorite podcasting applications. Thanks.